Greetings, everyone. We are going to give it about one more minute as people log in and join, and we'll get going about 11:01 here. Thanks for joining us today. We still have people joining as we speak, so I'll give it a few more seconds, then we'll turn it over to Jeff Bontrager to start. Right. Good morning, everybody. This is, thanks for joining our webinar, and I'd like to turn it over to Jeff Bontrager to kick us off.
Hey, good morning, everybody, and happy Friday. Thank you so much for joining us today. My name's Jeff Bontrager. I'm Director of Research and Evaluation at the Colorado Health Institute. And we are really pleased to be talking today about a needs assessment for school-based healthcare that CHI conducted. And first, you are going to hear from the analysts at the Colorado Health Institute who conducted the needs assessment and about what they found. And then I'm going to moderate a panel of people who are doing the day-to-day work of providing access to care in school settings. So for those of you who might be new or unfamiliar to the Colorado Health Institute, we are a nonprofit research institute founded in 2002. And our mission is to improve the health of all Coloradans through independent research and analysis and insight that supports sound policies and decisions. And we do our consulting work with clients who share our mission, and we also receive grant funding to carry out public benefit research, like the School-Based Health Center project that you're about to hear about today. A quick housekeeping note, your camera and your speaker are turned off, but please feel free to introduce yourself in the chat by using the button at the bottom of your screen. And it looks like we have quite a few attendees, and more are entering the call as we speak here. So we appreciate that you could all join us today. If you have questions for our panelists or presenters, please put those in the Q&A function at the bottom of your screen. And our presenters will take questions specific to their analyses at the end of the presentation. Questions about policy and strategy regarding school-based healthcare can be saved for our panel discussion. So without further ado, I'd like to turn it over to two of CHI's star research analysts, Julia Char-Gilbert and Lindsay Whittington, who will tell us about their analyses.
Thank you so much for that introduction, Jeff, and thank you all for taking the time to join us today. My name is Julia Char-Gilbert, and I'm a research analyst at the Colorado Health Institute. I wear a couple different hats at CHI. I'm on our legislative services team. I work on a number of CHI's evaluation projects, and I conduct research and analysis related to health and health policy in Colorado. Most recently, I led our 2021 school-based healthcare needs assessment, and I'm excited to share some of our findings from that work with you all this morning. I'm also joined today by my colleague, Lindsay Whittington, and I'll let Lindsay introduce herself as well.
Thanks, Julia. Hi, everybody. My name is Lindsay Whittington, and I'm also a research analyst at the Colorado Health Institute. I work as a data lead on many different types of projects at CHI, and I'm also one of our mapping experts at CHI as well. And I work with Julia to develop the interactive online tool to showcase findings from the school-based healthcare needs assessment in a way that's useful to you all as stakeholders. A little bit about our plan today. We'll start by providing some background on school-based healthcare as a model, and then we'll share some key findings from our 2021 needs assessment. And we'll close by showing you how the online tool we developed can be useful to you in your day-to-day work, whether you work in education, healthcare, public health, or policy. And with that, I'll hand things back to Julia to talk a little bit about school-based healthcare.
Great, thanks, Lindsay. So I know we have some school-based healthcare experts in the audience today, as well as some folks for whom school-based healthcare is maybe a newer area of interest. So I want to start with just a quick level set so we are all on the same page. So a little on school-based health centers. School-based health centers are healthcare facilities located inside of schools or on school grounds. They're created by a partnership between a school and a medical organization or a medical sponsor. Staff at school-based health centers collaborate with school nurses and staff at the school, but they themselves aren't necessarily employees of the school. School-based health centers offer a wide range of services, including well child exams and immunizations, as well as care for chronic conditions, care for illness and injuries, mental health care, reproductive and sexual health care. Some locations even offer dental care. School-based health centers serve patients regardless of insurance status, and they're typically located in communities that experience structural barriers to accessing care. So they're an important component of the healthcare safety net. There are currently 69 school-based health centers across the state of Colorado. You can see their locations on this map here, where every purple dot represents a school-based health center. This map comes from CHI's interactive online tool. You'll see a couple of visuals like this throughout our presentation, and all of these materials are available to play around with on CHI's website. In the case of this map, we realized that each school-based health center in Colorado is unique. So for example, some focus on serving students in their district, while others see patients from the greater community as well. So if you're looking at our interactive online tool and you want to learn more about a particular school-based health center, you can click on its location on this map and more information will pop up like this. So here we see that the center at Canyon City Middle School serves any student in the district, plus student siblings, staff in the district, and the children of staff as well. So that's school-based health center as a model. Let's talk about impact. Studies have shown that school-based health centers have a measurable impact on the communities that they serve. In terms of health outcomes, school-based health centers have been found to decrease hospitalizations and visits to the emergency department, decrease use of alcohol and illicit substances, and decrease rates of pregnancy among the students they serve. They've also been shown to improve immunization rates, improve mental health, and improve outcomes for students with asthma. School-based health centers also improve educational outcomes, like high school graduation rates, the likelihood that students repeat a grade, and students' grade point averages. Given all this, given that school-based health centers have positive impacts on student outcomes, if we situate school-based health centers in communities that bear the brunt of health disparities, they can be a really powerful tool for advancing health equity. So it's with all this in mind that our team at CHI started in on our 2021 school-based healthcare needs assessment. We began with a simple guiding question: which schools in Colorado would benefit most from the establishment of a new school-based health center? Another way of asking this is, which schools are most in need of improved access to care? To answer these questions, our team at CHI turned to the data. So the first thing we did was get a list of all the public schools in Colorado, including charter schools. In total, there are about 1,900 public schools in Colorado, so we had a pretty good pile of data to sift through. Next, we went about identifying indicators or data measures that give us a sense of what access to care looks like in different communities or regions of the state. So we looked for measures that met a few different criteria. We wanted measures that were specific to children's health rather than the needs of adults. We wanted measures that were non-duplicative, so they weren't redundant with one another. We wanted measures that were as geographically granular as possible, so we could really pinpoint where the need was greatest. And we wanted measures that were as current as possible and that came from trusted data sources like the Colorado Department of Education and the Colorado Department of Public Health and Environment. Ultimately, we identified 14 different measures that we felt collectively painted a picture of what access to care looks like in a given community. And we used those measures to create an index. All the measures we selected fall into one of a handful of categories, which I'll walk you through now. We know that this list is non-exhaustive, but we think it does a pretty good job of capturing where the need to improve access to care is the greatest. We looked at health outcomes and risk factors, including rates of obesity, asthma, depression, vaping, and pregnancy among Colorado youth. We looked at health insurance coverage, including the percentage of children who are uninsured and the percentage insured by Medicaid. We looked at access to care and utilization of care, including the percentage of children without a medical home, the number of physicians in a county relative to the number of children in that county, and the percentage of children who didn't have a dental visit in the past year. We also looked at students who face unique barriers to accessing care, including students who are English language learners, students who are eligible for free and reduced price lunch, and schools where truancy rates are high. And finally, we wanted to capture the economic impact the COVID-19 pandemic has had on Colorado families, and so we included changes in unemployment rates as well. So we took this collection of data and we synthesized it, and we used it to assess which schools had relatively high healthcare needs relative to other schools in the state, and which schools had relatively low healthcare needs. Schools were then sorted into one of 5 categories based on relative need. You can see those categories here. Now, to be clear, these categories have nothing to do with school quality or student performance. So if you see schools that have been classified as highest need or higher need, all that means is that according to our analysis, students at those schools might be experiencing more significant barriers to accessing healthcare relative to the average Colorado school. And so those are the schools that might benefit most from expanded access to care. So that's a little about our approach to the needs assessment. I'm now going to pass things over to Lindsay to tell you a little about what we found.
Thanks, Julia. So as Julia mentioned, there are about 1,900 public schools in Colorado, which makes it kind of difficult to just glance at an Excel spreadsheet and immediately see trends in the numbers. So the first thing that we did was actually plot the data on a map, which looks like this. Schools with the highest needs show up as red dots, while those with lowest needs are blue, and schools that fall in between are orange, yellow, or green. Now, there's a lot of rich information here, so let's pull out a couple of key takeaways for you all. So first, I want to draw your attention to rural areas of the state. Now, rural areas in Colorado face unique barriers to accessing care, and access to school-based healthcare is no different. For example, let's take a look at the San Luis Valley and southeastern Colorado, which you can see highlighted here by these 2 boxes. We see here that many highest need schools are located in these 2 regions of the state. There are currently no school-based health centers in the San Luis Valley or in southeastern Colorado. So this represents a significant opportunity for expanded access to care in this region. So now let's take a look at a couple of urban parts of the state. Work remains in schools' urban counties as well. For instance, many high-need schools are located in Pueblo County. We also see quite a few high-need schools in Adams County as well. But the relative need in urban Colorado and in the Metro Denver area in particular is highly variable, and the disparities are stark. For example, the lowest need schools are found in Boulder, Jefferson, Douglas, and Larimer counties, which are just a short distance away from the highest need schools in Adams County. And in Denver and Arapahoe counties, we see a mixture of higher, medium, and lower need schools, all within a few miles of one another. So now I'll give you 2 examples from the Denver Public School District to illustrate the diversity of schools that exist even in just the Metro Denver area alone. So Monroe Elementary School is an elementary school in the Westwood neighborhood in Southwest Denver. It has about 400 students, and it serves kids up through the 5th grade. Now, just a 12-minute drive to the east is Steele Elementary School, which is in the Washington Park neighborhood. Steele is similar size to Monroe. It has about 500 students, and it also serves students up through the 5th grade. In many ways, these schools look quite similar. They're both medium-sized elementary schools in the Denver Public School District and both located just off of Alameda Avenue. But the barriers that students at these schools face look really different. At Monroe Elementary School, 99% of students are eligible for free or reduced price lunch, while at Steele Elementary School, 8% are. At Monroe, 66% are English learners, while 4% are English learners at Steele. Now, ideally, being lower income or speaking languages other than English should not impact your ability to access healthcare, but we know that lower income households and speakers of languages other than English currently face structural barriers to accessing care. And recognizing and addressing those barriers is a critical component of ensuring equitable access to care. So as we highlight places where disparities are particularly stark, we shouldn't overlook the incredible work that's already being done in those communities. In fact, many of you on this call today are doing that great work. For instance, there are already 8 existing school-based health centers in Adams County and 6 more in Pueblo County. This is a clear indication that existing school-based health centers are well-positioned to reach those students who face significant structural barriers to accessing care. Persistent needs in these areas also suggest that in addition to access to care, other factors that affect students' health continue to present challenges for many Colorado's kids. Everything from environmental factors like exposure to air pollution, to social and economic factors like access to jobs that provide health insurance, or at least enough money to meet a family's most basic needs. In other words, we must tackle access to care in conjunction with other efforts to improve children's health. Now I'm going to hand things back over to Julia to discuss another important set of findings from the assessment.
Thanks, Lindsay. So finally, I want to highlight the ways that racial and ethnic inequities show up in the data. In short, CHI's analysis found that on average, students of color face more significant barriers to accessing care than their non-Hispanic white peers. So here's a graph showing the racial composition of Colorado public schools. Let me get you oriented to what you're looking at here. Bars on the left represent the percentage of Colorado schools where a small proportion of students are people of color. So for example, at 17% of Colorado schools, 0 to 20% of students are students of color. Bars on the right represent the percentage of schools where a greater proportion of students are people of color. For example, at 16.5% of schools, the vast majority, or 80 to 100% of students, are students of color. Big picture, what we see here is that about 1/3 of Colorado schools have student bodies where between 20 and 40% of students are students of color. And schools are otherwise more or less evenly distributed across these other categories. I start with this graph because if there were no racial inequities in the data, when we looked at just a subset of schools, like just the highest need schools, for example, we would see this same distribution, the same shape. Unfortunately, that's not what we see. Here are the highest need schools in the state by racial composition. Compared with the previous graph, you'll see that the bars on the right are taller and the bars on the left are shorter. What this means is that schools that serve predominantly students of color are overrepresented among high need schools, and schools that serve predominantly white communities are underrepresented among high need schools. Now let's look at the lowest need schools in the state. The difference is really stark. Among the state's lowest need schools, predominantly white schools are dramatically overrepresented. Over 9 out of 10 of our lowest need schools are predominantly white. Meanwhile, less than 1% of Colorado's lowest need schools are attended predominantly by students of color. Here are those exact same numbers I just showed you plotted in a single graph. In short, whiter schools, which you see on the left, are more likely to be low need, and schools that serve more students of color, which you see on the right, are more likely to be high need. Now, to be very clear, the reason we see these inequities is not because students of color are somehow predisposed to poor outcomes, right? These inequities are the product of a long and enduring history of discriminatory policies and practices in our health and education systems. For example, a combination of education and housing policies in the United States have effectively separated students based on race and have disinvested in schools serving children of color. The effects of those types of policies show up in this graph. On the flip side, though, thoughtful, evidence-based, equitable policy and programming can help rectify the inequities we see here. So to sum up our key findings, I'd like to underscore 3 opportunities to expand access to care for young Coloradans. First, our analysis found opportunities to expand access to care in rural Colorado. In particular, the San Luis Valley and Southeast Colorado are home to many high-need schools, but there are currently no school-based health centers in those regions of the state. Second, we see stark health disparities among young people in urban Colorado. This signals a need for targeted investment in communities where health needs are highest, including Pueblo County and Adams County. And finally, the racial inequities in our health and education systems are unmistakable. Our data underscore an urgent and profound need to address the systems that produce and perpetuate racial health disparities in Colorado. CHI's analysis found that the state's existing school-based health centers are already doing extraordinary work along all 3 of these fronts. And new school-based health centers present opportunities to further expand access to care in communities where the need is greatest. CHI's analysis is very much a starting place. We realize there are lots of considerations that our analysis does not touch on, like the availability of medical sponsors, the financial sustainability of potential sites, and community interest in getting a new school-based health center off the ground. But what our analysis does do is identify pressing needs, spotlight promising opportunities, and hopefully empower folks like you all to carry this work forward. In that spirit, I'm going to pass things back to Lindsay one more time to demonstrate how you all can use CHI's interactive online tool in your work.
Thanks, Julia. So one of the amazing features that came out of this needs assessment was the online interactive tool. So this tool brought together all the data that helped inform the needs assessment, and it also allows users to dive deeper into these data to help inform on their own work. So to help showcase this tool, I'm going to now lead a demonstration of the online tool to help our audience understand how they can utilize this tool and hopefully answer any questions that they may have regarding its utility. So I'm going to share my screen. Okay, so we should be seeing the tool. So the great thing about this online tool is how it has the local perspective always in mind. So for instance, if you really want to learn more about a particular school in your community, you can click on that school's location and see all the data associated with that school. So to help showcase an example, I would love now to have members of the audience to put names of schools of their communities into the chat feature so that I can utilize some of these schools to demonstrate the different features of the tool. So if you could provide the name of the school and the zip code or the city that it's in, that would be great. So go ahead and enter schools in now. Awesome, looks like we're getting a lot of schools coming in. Okay, so I'll start. The first one I saw, let's see here. We have Durango, Solocup. Let's see, we got Fairmount Elementary. So let's use Fairmount Elementary. Okay. Thank you so much, everybody, for your participation. So I'm going to utilize Fairmount Elementary School as the example that I first saw to help demonstrate this tool. So to find your school of interest, you can utilize the search bar up here, which I started to use at the top right-hand side of your screen. We find that it's most effective to use exact addresses if you have a very specific school in mind, but many schools are already featured in the search layer of the tool that the tool uses. So names also work for many schools throughout Colorado. Oh, I just had it. Let's see. Here we go. All right. So Fairmount Elementary School in Golden, Colorado. So by clicking on the colored dot that comes up nearest to your search result, you can actually pull up all sorts of really valuable information about your school and the community in which the school resides. So for example, when I click on the pop-up, I can see the name of the school district that it's in, but also lots of really rich information about health outcomes, health insurance coverage, access and utilization of care, as well as additional indicators about student need and economic impact of COVID-19. So we've organized these together to really help highlight these different indicators that were utilized during the needs assessment. So this can be really helpful for folks. So we can see that in this specific region, we can see the asthma rate for high schoolers and all sorts of other rich information. Okay. So say you don't have a specific school in mind that you're trying to locate, you can also utilize other geographic regions such as cities or counties to also narrow in on other areas of interest that you might be thinking about or looking for more research on. So for example, if I just type in El Paso County will come up as a region that will zoom in on, and I can now see that in my search result, I get El Paso County and I can see all the different schools that are mapped within this county of interest. So let's say you have a city in mind. You can also just type in cities like Fort Collins, Colorado. And it'll take you to that, oops, looks like we got Palomar Ridge. Okay, Fort Collins, Colorado, 80521. Okay, for some reason it keeps taking me back to Palmer Ridge, but a lot of the different municipalities are also logged in here as well. It might just be an issue with the background right now with my internet. Okay, so you can also get specific cities of interest, any other types of geographic areas that you are most interested in. And when you go into these areas, you can pop in on any of the schools within these jurisdictions to help highlight any of the schools that fall within these boundaries, which can be really, really helpful if you don't have a specific school in mind. So in addition to the different the mapped schools and all the different rich data that are available on the map, I also created different filters that help you further dive into specific characteristics of interest that you might be interested in looking at or researching further for your schools throughout Colorado. So for example, the first filter I want to talk about is the relative need filter, which is on the right-hand side of the screen. So this one organizes all the different schools by the needs, highest to lowest need as identified by the index. So for instance, if you're interested in just the highest need schools, you can activate the filter and it'll only show up those highest need schools that we identified in red, which can be really helpful to further analyze data for specific need schools. But maybe you're interested in those with below average needs. So you can also toggle both of the filter options to further present both of those groupings. So if you want to look at specific needs, you can turn on any one of these to look at those specific schools side by side. So in addition to the relative need filter, we also created the filter by school characteristic, which can really, really be helpful for lots of folks. So this filter actually allows you to filter further by urban and rural status, student body size, percentage of students of color at the school, and if there is an existing school-based health center on the school's campus. So for example, if I'm just interested in rural schools, I can utilize this filter option to click on the rural schools and apply. And now it will only show the rural schools throughout Colorado. So this can be really helpful if you're looking at a particular characteristic instead. So say I'm also interested in student body size for certain schools. Maybe I only want to look at schools that have 200 students to 400 students. So a really easy way to do that is look at the student body size filter, go down to the drop-down menu, scroll down to 200 to 399 students, click apply, and now we can see that only schools that have 200 to 400 students are actually now identified on the map. So this can be really helpful if you want to further filter by certain characteristics. So in addition to just the one filter, you can also look at a combination of specific characteristics. Specifically, student body size is one that I think would be really helpful for folks. So maybe I'm interested in just 200 and more students, not just 200 to 400. So one really great feature from this drop-down menu is you can further analyze data by utilizing some of these additional filters. So if I want to look at the schools that have 200 or more students, I can use the greater than or equal to, which basically just says I want schools that are greater than or equal to 200. Click apply. And now it's just giving me schools that have 200 or more students instead of just 200 to 400. So we can see now it's capturing schools that have 1,000 or some of those greater, so schools with more kids that go to those schools. So I think one of the also really cool options that you can do is you can put together the school characteristic filter as well as the relative need filter, which can really be helpful to further dive into certain schools by characteristic as well as need. So for example, if I only want to look at urban schools that are highest need, I utilize the filter by school characteristic here. I click on urban, click apply. Now it's only showing schools that are characterized as urban schools. And then I come over here and I click on my highest need school filter. So now I'm only looking at schools that are designated as highest need schools that are in urban areas of the state. So this can be really helpful for folks if you want to look at specific characteristics and then further identify schools by need. So if you are interested in rural schools with highest need, or you want to look at schools that serve communities of color and see how they're faring, you can utilize the combination of these tools to really help answer your specific questions. All right, so I hope that that demo was helpful for folks. Julia will now wrap up our presentation and help lead us into our panel discussion.
Great, thanks, Lindsay. So just one final note for our audience. If you take a look at our analysis and the interactive online tool and you still want to dig deeper, all of our data are actually available for download on CHI's website in an Excel format. You can also reach out to Lindsay or me with your questions or with your feedback following this session. We're always happy to connect, and someone from CHI's team will put our contact information in the chat box for you. In terms of more immediate questions, if you have questions for our panelists, please hold on to those for now and submit those through the Q&A during our panel discussion when we will have our community experts weigh in. If you have questions specific to CHI's analysis, go ahead and drop those in the Q&A box now, and Lindsay and I will do our best to answer your questions. I see a few of you have actually already getting started on submitting some questions for us, which is great. I think we'll start with a couple of those, but go ahead and keep adding things to the queue. I think we'll have time for a number of questions. I do want to leave plenty of time to hear from our panelists, so I think Lindsay and I will take a few questions about the analysis now, and then we'll tackle the rest of the questions in the Q&A forum itself. So our first few questions are around some of our measures, some of our indicators, and where that data came from. So I'll tackle a number of these in one go. So around inclusion of oral health data, we used, in terms of oral health metrics, we used the number of students, or the percentage of students who reported not having a dental visit in the previous 12 months. That data comes from the Colorado Health Access Survey, or the CHAS, which is a survey of 10,000 Colorado households that CHI conducts once every 2 years. So the data that's included in this analysis, the 2021 needs assessment we're describing today, that's all from 2019 CHAS data, but our 2021 CHAS data, or CHAS rather, is currently in the field as we speak, and we'll be expecting that data in-house later this year. So keep your eyes out for that. We're expecting that, I mean, every year the CHAS has really, really rich information about the health of Coloradans, but particularly this year, when I think it's especially essential to understand how the pandemic has affected Coloradans and their health. We're expecting that this data set will be especially useful this year. So keep an eye out for that in the coming months. In terms of other indicators that folks have asked about, the data around health outcomes and risk factors largely come from the Healthy Kids Colorado survey, which is facilitated by the Colorado Department of Public Health and Environment. So our metrics around asthma, obesity, depression, and vaping among Colorado youth all come from that source. A couple other indicator questions. I want to make sure I hit on all of them. Oh, data on depression rates also comes from the Healthy Kids Colorado survey. Things like teen pregnancy come from the Department of Public Health and Environment as well. We also have data in there from the American Community Survey through the US Census Bureau, the Department of Healthcare Policy and Financing, or HCPF, and a number of other data sources as well. If you're interested in our methodology, interested in our sources, all of our sources are included in CHI's online tool, as well as our methodology section, and all that info is at the URL that someone has just shared in the chat box. Any other questions for us today? Do you have any plans to keep updating the tool as new data is coming through the following years? That's a great question. So in this moment, in terms of updating this tool, we don't have any short-term plans, but the nice thing about the data sources we've used is that they're basically entirely from publicly available data sources. So CHI could endeavor to update these as we go pretty easily, and also as folks sort of in terms of like stakeholders, people like you all in the audience today, see room to update that data, add metrics, remove metrics to see as to best meet your needs or your interests, you can do so in our Excel spreadsheet, which again is available for download. But we are committed to making sure that this is a tool that is as useful as possible. And we recognize that having up-to-date data is a good way to do that. And that's why all of the data that's included in the tool reflects the most up-to-date data possible. So most of it's coming from 2018, 2019, and unemployment change data would be as recently as this past summer. Okay, well, feel free to continue to drop questions in the chat for us. We're happy to continue to address them in the Q&A. And as we mentioned, you're always welcome to reach out offline as well. And thank you again so much for your time today. We so appreciate your time and your interest in school-based healthcare in Colorado. I'm now going to pass things off to our colleague, Jeff Bontrager, to get us started with our panel discussion.
Thank you so much, Julia and Lindsay, for that demonstration. And I think judging by the amount of feedback or the number of schools that were put into the chat for the demonstration, I think that this tool is going to be really helpful for people. This analysis brings up lots of questions for me, as I'm sure it does for many of our attendees today too. And we have assembled a panel of experts in school-based healthcare to talk about where we go from here. So it's my pleasure to introduce them now. Excuse me. Excuse me. First off, we have Maria Zubia, who is the Director of Community Outreach at Kids First Healthcare. And she has been an integral member of Kids First Healthcare team since 2001. She is responsible for providing community engagement and outreach activities, and she has over 30 years of experience in community navigation and management. Maria is also a member of the Adams 14 School Board, and her comments today reflect her role at Kids First Healthcare and not of the school board. Next, we have Cristina Bejarano, who is the Director of Engagement at the Colorado Association for School-Based Care. She is the driving force supporting school-based health centers in having what they need to succeed, be it training or collaboration, community needs assessments, quality improvement, and more. So thank you, Cristina, as well for being here today. And then third, we have Michelle Schultz, who is the manager of the School-Based Health Center program at the Screening, Brief Intervention, and Referral to Treatment School-Based Health Center project at the Colorado Department of Public Health and Environment. And she brings a passion for child health and previous work experiences in topics such as adolescent health disparities, healthy eating and active living in school settings, and youth tobacco cessation. So thank you all for joining us today. And I've got some questions for all of the panelists, and I've got some questions that are focused on each of the panelists. So we'll do a mixture of both. The first question is about equity, and we titled this webinar, Pursuing Equity Through Colorado's School-Based Health Centers. Julia talked about some of the inequities that we see just by analyzing the data of this new tool. So I'd like to ask each of you, what is one piece of advice for you that you have for people who are working to advance health equity, which I know a lot of our attendees are doing here in Colorado. Alternatively, you could provide what is one way that school-based health centers can advance equity. Feel free to also add in how you think about equity or how you might define equity if you have any particular kind of framework that you have to think about health equity. Maria, we're going to start with you. How do you think about equity, and how can school-based health centers aid in addressing inequities?
So first of all, good morning, everyone. Thank you for this opportunity. First of all, I'd like to say that for me, equity, just the word alone, doesn't mean a whole lot. It's a buzzword that comes around every 3-5 years in different fashion, different form. And so it's just, you know, as a person of color, as a Mexican American, I can tell you that for years, in fact, my whole life, I've been struggling with what that is. And so I think, first of all, everybody needs to come up with a definition that they're comfortable with. And every time I ask, well, what is your definition of equity? I get a different response, right? Everybody has their own. And so for me, I think that the way I best describe it is, it's kind of like that zero, you know, it doesn't mean anything until you add something to it. So for me, it's always been, you know, what is it that we're trying to achieve? So to what end are we looking at equity? So for us and our school-based health centers, because we are very mission-centered, I mean mission-driven and patient-centered, it's about equitable outcomes for our patients. That's really what it boils down to. We just want every child that comes to us to have the, you know, the same thing everyone else does. And those equitable outcomes puts it in a whole different perspective than if you just say equity by itself. So for me, that's pretty much how I look at it. And I'm sure I would have many other people who would challenge that and say, nope, it's this way, and that's fine. I'm just saying for us, that's what works, is really keeping it and looking at it through that lens, especially, like I said, we are mission-driven and patient-centered, patient-focused. And when you do it that way, it just makes it a little bit easier.
Great, thank you so much, Maria. Michelle, I'm going to go to you next. How do you think about equity, and how can school-based health centers address inequities?
Thank you, and good morning. I'll echo a lot of what Maria said in saying that, you know, I think of equity as achieved when every Coloradan has the ability and the opportunity to thrive regardless of who they are or where they came from. And so this, you know, to achieve that does require eliminating barriers, which, you know, that's one thing that school-based health centers embrace as a model. You know, they are an evidence-based model to bring healthcare services where students are at, breaking down some of those barriers around accessing those healthcare services and around getting the transportation to them, the health insurance to access those services, knowledge of the service availability, et cetera. So I think that school-based health centers are a great track to addressing health equity.
Thanks. And Christina.
Good morning, everyone. Thank you for having us. I agree with everything that both Maria and Michelle said. And to add to that, with school-based health centers, just by being next to the main partner, the partner that they married, the school, is trying to create that equity for the parents by nature and purposely. School-based health centers are established in communities that have been forgotten, marginalized, and like your data beautifully shows, the students that need the most support. So the work that we're doing is trying to create that equity and facilitating for the parents to be able to have their kids have access to the health services and behavioral health services that they need, and also building that trust with the school. And we see when students are able to increase their health outcomes and also their educational outcomes, the communities that have been impacted will be able to break out of the poverty cycle. And that's how we think that school-based health centers can really make a difference.
I think you're muted, Jeff.
Sorry about that. I think that during this pandemic, we have talked a lot about it, at least at the Colorado Health Institute, about how the pandemic has laid bare many of the disparities within our society. And I wanted to ask specifically about the COVID-19 pandemic. And so Maria, I'm going to go back to you. How did COVID-19 affect school-based healthcare? And how did school-based health centers respond to the myriad challenges that the pandemic presented?
Thank you for that question. To begin with, I have to say that you're right. You know, for years and years, many of us who are in the weeds and the grassroots level will tell you that we have been advocating for these same social issues over decades. And not until the pandemic hits do people really realize that, oh my goodness, there's insecurity and hunger. There's, you know, kids need all of this, and, you know, our elderly need that. And I'm like, oh my goodness, for years we've been saying this, but it finally got highlighted, unfortunately. And my analogy for that, it's kind of like, you know, when you're at the beach and the water comes up, and then, you know, it goes back, it digresses back, and then it leaves the little shells and stones. Well, that's kind of what the pandemic did. It just came up and then it left, and all of a sudden it highlights all of these issues that many of us have been really trying to help people navigate through for many, many years. For our school-based health centers, I guess the obvious answer would be, well, if there's no schools and the schools are closed, then the clinics are mostly closed. And for us, what helped is that we have 3 clinics that are year-round, because they have their own entrance and exits, and they're located in 2 of them are located in school buildings, and 1 is on school property. So that really helped, because then we were able to direct traffic from our other clinics or patients from our other clinics to those 3. It really did make us think differently, right? Everybody was trying to think outside the box for a while, which is wonderful. So it made us be a little bit more innovative, and not just a little bit, but a lot, and allowed us to pivot quickly because people needed our help. So once again, maintaining the fact that I said that our organization is really mission driven and it's patient focused, we had to make, you know, take whatever barrier was there out so that we could help families the best way we could. And so we developed, one of the first things we did is we developed our enrollment consent form in an electronic way so that it's HIPAA compliant and people could sign from home and they could start taking advantage of our telehealth services. So that's the second thing we did. I think all of these worked together, but the other thing we did is telehealth was expanded, not just from mental health, but into physical health. So that was something that needed to happen right away. And then we ended up really looking to see what else we can do. So we created a way to work with we selected, I guess, a company that could do mass text for us. So we were doing mass text for a while there to notify our patients of what was going on. And, you know, and these are practices that we've kept so far. They still work. I mean, we were looking at them prior to the pandemic, but then as soon as the pandemic hit, and we realized it needed to be done even quicker. And so, which I have to say a shout out to our community advisory committee parents that told us like 3 years ago that we needed to have an electronic form. We needed more videos. I mean, we had a lot of parents and a lot of stakeholders who have really helped us over the years. Our youth advisory board voice, these are some of the ideas that they had come up with that for a while now. We were like, okay, let's look at it. But now with the pandemic, it just made us really get on it and try and figure it out because we no longer had time to spare. The other thing the other thing we did is we worked with HICPA so we're a presumptive eligibility site or a certified application assistance site for Medicaid and CHP Plus. So it allowed our care manager to actually work remote and be able to call families and do that process over the phone and make sure that she was still assisting the families that needed it the most. So with I think with all of the things that we were doing and just keeping up to date and up to speed with all the ever-changing information that was coming down from, the Center for Disease Control, that was coming down from the state, that was coming down from our health department. We just have some amazing staff that were able to take that information. Our medical directors were able to take that, create some policies and procedures for our staff internally and for our patients. Just getting that information out. Communication is very important, especially when we have a high percentage of Spanish-speaking families. So just so you know, our text and everything we do is bilingual, right? It's in Spanish and English. So it takes a little bit extra time because I'm the one who was doing some of that work and it was taking me a while, but it's well worth it because then they get a message in a way that they understand it. One of my other things, another shout out to some folks out there that know about this is language justice. And I believe that that's very important. And so we just want to make sure that the information is in a way that they're going to comprehend and actually understand. It doesn't do us any good to put out beautiful materials if nobody understands the content. And so that's always been my my goal, is to make sure that our families are getting our information that they need. And so, and a big shout out to our staff, our frontline staff, because they were the most flexible when it came to making sure that they were still seeing patients at the clinic as much as they could with, everything in place. And we're still able to navigate the whole process of also offering the telehealth services to a lot of them. So it's just a lot of things that we had to come up with and do in the meanwhile, because these are children, they still need care, and their parents still need help. That's the other thing. We expanded. So instead of the typical outreach I would do, I started attending more committees and networking, because I do a lot of resource and referral. And so the majority of our families that were coming to us, lots of them need other things. It's not just healthcare. And we know for a fact, because we've been doing this at least as long as I've been there. I'm going on 20 years next month. And ever since I started there, we've been really trying to connect people to the right resources, because we know that if a family is, really stressing about hunger or some of the other issues, they're not really going to follow up a whole lot on what the healthcare provider has told them to do with their child. Because I've heard it, I have had families tell me to ask the doctor if they don't give the medication with food, will that be harmful because they borrowed cereal in the morning or something? And you're like, oh my goodness. So let's help you get to that next spot. So that we did a lot of that over the phone during this pandemic. And once again, I think the school-based health centers are positioned, like Christina said, with that trust that people will ask you and notify you that these things are going on. So yeah, just a lot of changes. Thank you.
Well, thanks, Maria. And I was reminded that I believe the very first school-based health center in Colorado, or one of the first, was part of Kids First Healthcare or Community Health Services back in the day.
It was Kids First Healthcare. We have had our name changed 4 times, I believe, but it was called the Health Co-op in 1978, and it was created by a Robert Wood Johnson Foundation grant in Adams 14. It was created by Adams 14 School District, actually created this model. And so we were the very first in the state, and one of the first in the nation, but not the very first, but one of the first in the nation as well.
Oh, great.
So,
congratulations. I know you've seen a lot of changes over the years, and this just represents another very significant change over the past year with the pandemic. I wanted to pick up on one thing that you said specifically around telemedicine, and I'm going to turn it to Christina, because a lot of school-based health centers, I know the catch word for 2020 and during the pandemic has been pivoting, but really the pandemic prompted many school-based health centers to pivot to offering telemedicine services for the first time. And so Christina, in what ways, kind of taking CASBIC's overarching view of school-based care in Colorado, in what ways do you see school-based health centers using telemedicine in the future? Do you think that telemedicine is here to stay? And what challenges or opportunities do you anticipate?
Thank you, Jeff and Maria. First of all, thank you for your 20 years of service. We always look up to Kids First for innovating. And with telehealth, like you said, before pre-COVID, there were only 2 school-based health centers using telehealth. A year later, all the school-based health centers are using telehealth. The opportunities are grand. We're looking at opportunities as far as being able, for example, most of the school-based health centers, and not only in Colorado, but nationwide, are in middle schools and high schools. And the minority of those are in elementary schools. If there's more telehealth and parents are able to attend the visit when a child that is in elementary school is able to come to the site, we can increase school-based health centers and elementary schools, because there's that trust, first of all, and then the ability to help parents attend to their children's needs. And for healthcare and for public health, that would be a great change, because we're preventing a lot of the issues that we end up seeing later on with substance use and with behavioral health in general. The other area of growth that we see is that, especially in rural areas where it's so hard to recruit staff, we could be using telehealth from an area that is farther away where the staff is available to be able to serve rural communities where there's job openings for many months and the sites are struggling to hire in those areas. So those are some of the opportunities that we're seeing. We do see that, and some of the growth that is expected is that established or medical providers that do not have a school-based health centers are looking into having a physical location and serving locations that are external. And the first site that started with that service was in Centennial. They have been doing that for a while, and we learned a lot from them as pioneers. But that's something that their new medical providers and existing ones are thinking about. How do we expand access to care in new locations and or services? So adding the behavioral health provider that might be in their main site, providing services in other sites that are farther away. And some of the challenges are what we have seen with education, the lack of access to technology, to internet, and mainly we can just put it all in technology, because I can tell you, I'm back in the office today because I wanted to make sure that the connection was right. And so many of the patients that have benefited from this and the providers, they don't have the secure connection in their homes. So that's one of the main challenges that we have seen.
Well, thank you so much, Christina. I wanted to move to Michelle and ask about establishing new school-based health centers. So the Colorado Department of Public Health and Environment has supported school-based health centers for a long time and makes sure funding from the legislature gets to the health centers. We just saw a demonstration of this new tool that Julia and Lindsay developed for identifying areas of need within Colorado. What advice would you give to a community that may be contemplating starting a school-based health center program?
Thanks, Jeff. Well, I would say that our advice would be to first assess the need. And I think the tool that we saw in the beginning of this webinar is an excellent starting point for those conversations. And next is really getting the school site, the school district, and a medical sponsor together to establish buy-in for the school-based health center at the beginning of the planning process is a crucial first step. We've found that it's hard to build and sustain a school-based health center without full buy-in from these three parties. And, you know, in the planning process, we've seen some start up and then permanent closures of school-based health centers due to one or the other not fully or understanding, you know, the tenets of that school-based health center model. And then, you know, that's a devastating outcome. It's a loss of accessible quality care in a medical home for those students that, you know, had come to depend on that site. And as part of our grant program, we offer planning grants and startup opportunities for new sites. And we'll be releasing an opportunity this fall through a competitive request for application process. And that can support sites even in that planning stage. So I think too that, you know, it would be helpful to go to some of those sites that were red on that map and really reach out to medical providers in those communities as a first step to see if, you know, they would be willing to be a medical sponsor for a new site. So that's one starting point, but there are many, and we've found that partnering, particularly with, you know, Christina and her team at CASBEC has been really helpful in trying to work to find those sites that are ready.
Great. Thanks, Michelle. I'm checking the Q&A. We have a couple minutes for audience questions and answers for our panel. And the first question from the audience is, do you find that a lot of students use school-based health centers consistently as their health home? Or do school-based health centers also have referral systems in place for outside providers? And I would just ask the panel, since we are short on time, to just keep your remarks somewhat brief. But Maria, how about we start with you? Do you find that a lot of students use it as their healthcare home? And if not, are there referrals to other places, or maybe referrals for specialty care?
Yes. Okay. So that's my answer. So yes, because so as I mentioned, we have three clinics that are year round. So a lot of our patients become our permanent patients. We are going on, for some of our families, we are on third generation now of people that we've seen. And so yes, and then when they're in the school, the actual school for school year, the students are our patients there, but we are not a substitute for their medical home. So if they have another medical home, there's that connection there, unless we're their medical home as well. And then if they do need, you know, any type of specialty care, we tend to do that just like any other clinic. We will give them the referral. We will call. We have our staff is very good at making sure that they're tracking all of that. So yes, I think some of the challenges with the referrals though is, as you know, we see mainly adolescents in our school-based health centers. And so, and the reason we do is because I found years ago that parents tend to not take their kids very often to the doctor once they no longer need those shots for school. So when you think about it, once they no longer need shots at age 11 or 12, more or less, then they don't go as regularly unless they're sick. And so our adolescent population tends to need it the most right now, and it also helps them to self-advocate for their own healthcare. So I think that part of the challenge is the fact that you know, just getting the parents to really follow through with those specialty care appointments. But yeah, yes.
Okay, great. Well, thank you. I've got lots of other questions about, I mean, I know school-based health centers also provide important behavioral health services, sports physicals, et cetera. But I'm going to move on to another question from the audience. As we look to the future of school-based health centers, what do you think is most needed from communities or the state to elevate school-based health centers or expand new school-based health centers? Michelle, why don't, if you want to start with that one, thinking about the future of school-based healthcare in Colorado, what do you think is most needed from communities or from the state?
Well, I think one from the communities, it really is, that buy-in from the school districts and the schools to have those school-based health centers within on their school grounds. So that's more of a community level need. At the state level to expand new school-based health centers, we are always gracious and thankful for the line item that we have for school-based health center grants. And we do what we can with that to both grow the program and in terms of number of sites and sustain those programs that are already operating. There are not many other funding streams for school-based health centers. So part of that, is building sustainability around billing and coding. There are a lot of, questions about the future of telehealth and reimbursement that I think those questions post public health emergency. The answers to those questions will kind of help us figure out how we can sustain some of those advancements that we've made in that area, because I do think that, to Christina's point earlier, telehealth, telemedicine may help us reach more of those red dots on the map, more of those schools that need it, by having a hub and having other ways to access students at other sites.
Great. And Christina, did you have anything you would like to add?
Thank you for the question, because the school-based health center is the birth of a trusting relationship between the school and the medical provider. And the openness and desire from the schools to have this medical provider run a clinic from their premises is big. Is a big thing. So community support, so whoever's attending, if you want a school-based health center, you have to speak up so your board listens to you, so the legislators listen to you and then provide more funding. So the foundations that are supporting the school-based health centers are providing the additional support, because the school-based health center is not supported by itself. Even with grants from CDPHE, they need additional grant funding to do the services that the community needs. And it's a beauty, but it's also a little challenging, because each site is different depending on the needs of that community. So they need to speak up so the resources are available for them.
Great. Well, thank you all for answering those questions. I know we've got more questions in the Q&A, and perhaps we can send those to you and you can follow up directly afterwards, or we will send out a follow-up email with contact information, and we can make sure that you get connected to other folks who need information. In just the couple minutes that we have left, I wanted to do a lightning round for all three of you, where we kind of take the school-based healthcare out of the abstract. And I'm interested in hearing from each of you an example of how school-based healthcare made a clear impact on an individual or on a community in Colorado. And this is the lightning round. So I'm going to go in reverse order, and we'll start with Michelle first.
Okay, lightning round. We get a lot of great and powerful success stories from our grantees, and one shorter one to share here is we had a school-based health center provider highlight how they had reached a patient through their dental clinic day. And this student came in, noticed it was dental clinic day, had never been in, had a toothache. And the hygienist saw him immediately, relieved his pain, and referred him for cavities. He had never been to a dentist before. And while he was in that school-based health center site that day, he was then able to schedule a medical visit for screenings that were needed, and then was able to access a medication that he had been off of for 2 years. So I think this story just really underscores the value of that one-stop shop approach and just being right where the student is.
Great, great story. Thanks. Christina.
Yeah, integrated care. So the biggest impact right now is behavioral health. Being able to see the families and the children and get into people's homes right now with telehealth. And while the visit was scheduled for maybe a therapy session, you learn that there's no food, that there's no medication. That we have several examples like that, where we have been learning that this is an opportunity to get to know more about the real situation of our patients. And that's the main thing. It is not one patient, but it's several that through behavioral health entry door, we learn about the multiple needs that the family has.
Thanks. And Maria.
Well, I'm going to state the obvious. So I have thousands, hundreds of stories. So I'm not going to really touch on just highlighting just one of them. What I'm going to do is really give a little bit of direction. So I think it's important that when you do have a school-based health center, that you truly network with your community partners, because you really will need their help. I mean, we have a high percentage, as was talked about earlier with those little red dots. What would have been interesting is to see, close to those dots, or another layer of a map would have been how many of our kiddos or how many kids attend school that are uninsurable. And uninsurable for me is what people call undocumented. I don't like that word, so I use uninsurable. So the uninsurable population was the one that was most impacted during COVID from all of the others in these communities. These children, the stress of them not knowing and having to help their families, the ones that have to work because their parents no longer can work. I mean, it's just amazing, the resiliency. But that is, for me, that has been the challenge, is how do you find resources and information to help guide these families. So very important to have those partnerships in your community to make sure that you're doing it. And as a last note, just, we're one of the few school-based health centers that is really we're not sponsored. We are a true nonprofit. We have to do all our fundraising on our own to raise dollars for those uncompensated care, visits. And one of my wishes or goals would be that, somehow we would be able to bill for any and all insurance regardless, just to help support what we do. So that's what I have. Thank you.
Great. Well, thank you to Christina and Michelle and Maria so much for joining us today on the panel, and also to Lindsay and Julia for their demonstration. We would invite everybody to check out the new tool, and we hope that that will be informative for communities. So with that, we are at the end of our time together, and I hope that the past hour has really given you a lot to think about and some inspiration for a renewed commitment to providing access to care for Colorado's children in a convenient and highly effective setting, which is their schools. If you have a question that didn't get answered, please reach out directly to Julia or Lindsay, and you can find their email addresses and a link to the analysis in the chat box. And we will follow up with an email after the webinar ends. Also, if you'd like to get connected to any of our panelists, we can do that as well. So thank you so much for joining us today, and we hope that you have a happy Friday. Take care, everybody. Thank you.